If you are tired of many treatments before, but your melasma keep coming back, don't give up. Hello everyone, I'm Dr. Minjung Choi, a board-certified dermatologist from the Yeongjong Central Dermatology and Plastic Surgery Clinic. Today, we are addressing one of the most frequent and challenging cosmetic concerns, freckles, dark spot, and melasma. I often heard my patients say like this, "Doctor, I'm not sure, is that freckles or melasma? I tried laser treatment before, but it came back. How can I remove this dark spot safely?" If that sounds familiar, stay tuned. Today, I will explain the difference between the freckles and melasma, what causes them, and how we treat them effectively here at our clinic. The importance of the precise pigmentation diagnosis. I know it's confusing. Many of my patients say, "My face is just look brown and uneven. Doctor, can you just burn it all by razors?" But here's the secret. Even though all these spots, freckles, seborrheic keratosis, melasma, and even viral warts look similar, but they are fundamentally different. The truth is, there are so many types of pigmentations. The reason they appear is different, and the way we treat them must be completely different too. That's why you must see the dermatologist and get right diagnosis. Once we know the exact diagnosis of your spot, we can select the correct treatment method to perfectly clear. An easy tip to distinguish wart and the seborrheic keratosis from the other dark spots is that they are elevated bump so you can feel on the skin surface. For today, we will focus on the flat brown pigment that cannot be touched. Among many different flat pigments, I will explain the difference between freckles and melasma and which treatment are most effective. Freckles, also called sunspots or lentiges, are typically discrete, well-defined light to dark brown spots. Their size vary. This is epidermal pigmentation, primarily caused by sun exposure, aging, and genetic predisposition. They appear more on fair skin and dark with the sunlight. Because this pigment resides in the superficial epidermis, it can be easily removed by the lasers. Just one or treatment sessions often show noticeable improvement. Melasma, on the other hand, is a deeper, ill-imagined, smudged, diffuse pigmentation appears like a fog, often seen on the cheek, temple, and forehead. Melasma is pigmentation that spreads deep into the dermis. It's affected by hormone, wrong exposure of sunlight, frictions, medications, disease, and even stress. Therefore, melasma is not simply caused by pigmentation on the skin surface. It's more correct to view them as internal change of the body that makes facial pigmentations. If you aggressively burn the melasma, you will end up with the severe post-inflammatory hyperpigmentations and worse melasma. Around more than 10 to 20 gentle, laser, and pharmaceutical combination treatment sessions are needed for melasma improvement, and consistent maintenance care is essential. Melasma is a condition where pigment spread deep into the dermal skin due to breakdown of the skin barriers and chronic hyperactivations of sensitive pigment-producing cells called melanocytes. The melanocytes in the melasma patients are extremely sensitive. If you use the wrong laser treatment or scrub your face too much, they react and produce more pigment. That's why melasma often return after aggressive laser treatment or potent bleaching products. So, the goal is not to erase pigment immediately, but to calm and control it gradually. At our clinic, we combine precision diagnosis with a multi-step customized treatment plan tailored to your pigmentation type and skin depth. We use advanced laser systems such as 755 nanometer accentual dual lasers, very effective for superficial pigmentations and freckles without barrier damage. GB532 KTP vascular lasers, it can treat both pigment and damaged dermal blood vessels. Levelite SI, Q-switch, and YAG lasers safely break up pigment without damaging surrounding tissue. Pico in Brighten laser and Pico Plus laser Utilize ultra-short pulse to shatter deep pigment, making great effect for melasma and mixed pigmentations. For deeper or more stubborn melasma, we also add brightening pharmaceutical therapy like vitamin C, vitamin E, and glutathione, and topical skin barrier repair therapy, including liduran, hyaluronic acid, and gibberellic and tranexamic acid. Using radiofrequency device to gently suppress overactive melanocytes, the key is gentle but consistent stimulation, not aggressive laser blasting. The step-by-step approach. First, accurate diagnosis. We first analyze whether the pigmentation is epidermal surface or dermal deep. Freckle and sunspot responds quickly. Melasma need longer care. Second, stabilization phase. We calm the skin with antioxidant, skin barrier restoration treatment, and anti-inflammatory care. Third, laser treatment phase. We perform customized laser sessions, adjusting the wavelengths and pulse energy precisely. Fourth, maintenance and prevention. This is the most important part. Consistent sunblock use, avoid inflammations, appropriate home cares are essential to keep pigment from coming back. Home care tips. Apply broad-spectrum sunscreen over SPF 50 and PA2+ every morning, even on cloudy days and inside your house. Reapply sunscreen every 3 hours at outdoors. Avoid direct sunlight between 10 a.m. to 4 p.m. Use mild brightening products with niacinamide or tranexamic oxide. Avoid harsh whitening creams such as hydroquinone, as it can cause irritations for some sensitive skin types. Hydrate your skin well and avoid scrubbing your face harshly. Remember that some medications like birth control pills, anticoagulant, and anti-cancer drugs can potentially worsen pigmentations. Freckles and melasma might look similar, but their roots are very different. That's why correct diagnosis and tailored treatment are crucial. At Yeongjeong Central Dermatology, we focus on understanding your skin type, pigmentation depths, and trigger to design the safest, most effective program for you. So, if you are tired of many treatments before, but your melasma keep coming back, don't give up. With the right plan and consistent care, your skin can truly regain clear and radiance. I'm Dr. Min Jung Choi, and thank you for your watching.